this first 100 days of President Trump's administration, the National Mall in Washington has been full with both tourists and protesters. On their traditional tax day, April 15th, protesters took to the mall as a reminder that the president continues to break long-standing tradition by not releasing his tax returns. The president responded via tweet saying the election is over. And this march by anti-abortion activists was endorsed by the vice president, Mike Pence.
That's why this administration will work with the Congress to end taxpayer funding of abortion and abortion providers.
The vice president says money diverted from organizations like Planned Parenthood will still be devoted to women's health care, which is not how some women's health advocates see it, as our Jessica Gomez reports from Wisconsin.
They're trying to take away access to health care.
In Wisconsin, unlike most states, Planned Parenthood is the sole recipient of the federal Title X grant program. $3.5 million a year now on the line.
One of the biggest misconceptions is that federal dollars are paying for abortion services in Wisconsin, and that is just not true. There is federal and state law that absolutely prohibits that.
Planned Parenthood says the Title X money is used for reproductive health services, mostly for low-income women, cancer and sexually transmitted infection screenings, as well as birth control counseling and services.
Planned Parenthood, as Wisconsin and the nation's largest abortion provider, should not be receiving taxpayer dollars, really at any level of government.
State Republican Representative Andre Jacques already authored a state bill last year that would deny Title X funding to any Wisconsin health clinic that provides abortions. It passed the state legislature, and last month's congressional vote in Washington clears the way for it to happen.
I think it's entirely appropriate for a state health department to have a better sense of what are the health needs of the state of Wisconsin than a very narrow special interest.
Planned Parenthood of Wisconsin says it's already been forced to close 5 of its rural clinics since 2012 after the Republican governor and state legislature voted to slash its state funding.
In those 5 communities, there has not been another provider who has stepped in to fill that gap.
We have federally qualified health centers. We have outpatient clinics. We do have the county and local health departments. We have hospitals.
State Republicans maintain without a Planned Parenthood monopoly on federal funding, there would be more and better options for Wisconsin women.
They're vastly bigger in network. There are so many more of them, and they provide these kinds of services without all the controversy surrounding this issue.
It is incredibly just disingenuous for Representative Jacques and Speaker Ryan and Governor Walker to make the statement that there are other places that women can go, because their offices are not calling up community health providers or county public health departments to talk to them and to put together a plan. You know who is? Planned Parenthood.
One city over from Representative Jacques' district, in Green Bay, self-employed production stylist Rhonda Sitnikow. After losing her health insurance last fall, she had a tough time finding an affordable option for care. So she went to Planned Parenthood. That's where they told her something was wrong.
I would have full-blown cervical cancer. If I actually hadn't gone to Planned Parenthood initially, without a doubt, I am convinced I would not be sitting here today talking to you.
The single mom says she almost fell through the cracks and worries others won't be so lucky.
You are doing what you're supposed to be doing. You're a productive member of society. You are working, you're parenting, you're doing all the things you're supposed to do. You just want to be healthy, and you just want to stay alive.
In Wisconsin, for Matter of Fact, I'm Jessica Gomez.